Hello, Pit Partners for Health. This is Tiara Beal, your Healthy People, Healthy Carolinas coordinator, also serving as interim coordinator for Pit Partners for Health. Welcome to the March Pit Partners pre-recorded meeting. A lot has changed since we last met. There are 3,651 cases of coronavirus or COVID-19 in North Carolina. 57 of those cases are in Pitt County. Of course, those numbers may have changed by the time you watch this video. Other things that have changed including schools are closed, businesses are closed, grocery stores are being emptied. Thankfully, some time is being set aside for our seniors, and most of us are working from home. We are going to be working at home until April 10th, according to Pitt County. That's today. And then April 29th statewide. Of course, we all know that that may be extended. Some things that have not changed. Pit Partners is still staying connected in the ways that we can. Webinars, there's the YouTube, maybe we'll have a WebEx for the next meeting. If there are ways you can think of, please let me know. Our partners are still sharing information. That's the information that I share with you all and that you share with others. Thank you for doing that. Number three is that those most affected by coronavirus need us now more than ever, and they are definitely going to need us after, since most of the people affected are the ones most at risk for being affected by the social determinants of health. New folks, thank you. Welcome. Come on in. We're glad to have you. Here's your gift. Oh, wait, we'll give you your gift later. In a few months, I'm sure we will be able to have an in-person meeting. At that time, we would like to thank you for your time and attention. So please see me, Tiara Beal, or one of our lovely STEM members who serve as greeters sometimes for your gift. Thank you. The mission minutes in the meeting. Traditionally, we do read the mission statement at the beginning of each meeting, which is to improve the population health of Pitt County through coalition building and partnership. The minutes for this meeting will be shared via email. Well, not this meeting, but the minutes for the March meeting will be shared via email. Here are some highlights. Joni Torres shared with us why environmental health is public health. I shared that presentation. If you would like that shared again, please contact me. It will be available on the website, which will definitely be available very soon. It was National Nutrition Month, so Stephanie Cabinets with Lifestyle Medicine did share some healthy eating tips with us using pepitas. She will be sharing another update that should be attached to the email that this video is on, and I will probably upload that to the website and YouTube as well with her permission. And I'd like to thank the Farmville Recreation Center for hosting us and for the mayor for greeting us. Farmville is very willing to partner on many evidence-based interventions. It seems that we have a lot of the same goals, and we look forward to partnering with them when the coronavirus epidemic is slowed, stemmed, and over. The agenda. There's not going to be much going on, folks. This will be a very short presentation. I only want your attention for a short moment of time just to give you some action team updates, some community updates, and some upcoming events, which should now be called webinars or online trainings that are coming up. The first update is from Healthy People, Healthy Carolinas, or HPHC. I did meet with Population Health Improvement Online, which is a technical assistance for the Duke Endowment. The Duke Endowment was on the call, or they had a representative on the call who extended a heartfelt thank you to all healthcare workers and essential staff working to keep everyone safe and protected and healthy. Our report will be submitted soon, even though the Duke Endowment was gracious with extending the deadline some, but we are a little bit ahead of the game if anyone was wondering. For more information or background on that, that report is the end of grant report for our first 3 years of funding, and we were approved for an additional 3 years, but we have to submit this report first. Our website launch is only slightly delayed. We just have to get the IP address corrected and it will be ready. If you want it to be featured on that website, I will put the link in this week's email for your organization's information and logo. Pretty please make sure you have permission for that to be featured on our website. I'm also looking for new ways to connect, partner, and implement virtually, as well as many other HPHC coalitions. So if you have ideas or if you've seen them, please feel free to share them with me or with a member of the steering committee. Our initiative team chairs are very busy right now helping the community and, as Nikki Hyatt would say, keeping the Rona out of Biden. So thank you all for the work that you're continuing to do. And in their place, I will share some updates. Access to Care has put most of their activities on hold due to COVID-19 restrictions. Check Change Control would be one of those programs. When the restrictions are lifted, the plan is to implement that program by putting a blood pressure machine in Greenville Housing Authority residents' office. Healthy lifestyle, some of those initiatives or some of those evidence-based interventions are available online. Catch has made Catch at Home available. I featured that information on the Pitt Partners for Health Facebook page. Please go on and like our page if you haven't. Kids in Parks has a backyard adventures program, which is great at this time since the parks are closed, but these adventures they can still do in their backyard and collect incentives through the mail. Lifestyle medicine program is in the planning/initial implementation stage. Stephanie shared an update last month, and you can expect one this month as well. If you're interested in being a part of that work, please email her, Nikki, or Mary Taylor Gaskins. Mental health did meet via WebEx on Wednesday. Trillium is still hosting online trainings and being a resource to the community. I've seen their name and information featured in some other community groups working to provide some community relief at this time. There are also trauma-informed community webinars still taking place. The next one is April 15th at 3 p.m. I will send that information out via email as well. Events and resources from the community, most have been canceled, but there are groups putting together fundraisers, food bags, and sanitation kits. I've sent that information out as well. If you have additional information, resources, or drives that you know about, please send them to me and I will share them where applicable. Please make sure to get your information from trusted resources for COVID-19. Biden has a really great page, and the number of COVID cases in the Biden health system is featured at the top. If you're interested in knowing those numbers, Pitt County Health Department has many links to the CDC and DHHS, and they live stream every Tuesday and Thursday with updates from Pitt County that include information from the school, from Vidant, from what's going on with our police department, and much more. You can also submit some questions online. And then, of course, NCDHHS has a COVID-19 dashboard that you can break down COVID-19 cases by many demographics. Some community resources or updates. There's a Facebook group called the Pitt Greenville COVID-19 Community Outreach Task Force that has reliable information for community members to find out about what resources are applicable to them, to their homes, to their businesses, or to their neighborhoods. If you would like to be a part of that group, please reach out to me and I will invite you. I'm not sure if we have to be friends for me to invite you or not. I'll have to look into that, but please contact me and I'll get the ball rolling at least. Joy's Soup Kitchen is closed for cleaning. I did want to say that since I sent out an email with a donation list for them. Please check their website for where donations are going to right now. And if I have any additional information, I'll send that out. Then 211 is also getting a lot of calls right now and a lot of traction, which is great. Over 17,000 calls so far. You can sign up to receive some of those messaging by texting COVID NC to 898211. And that is all I have for you folks. I think that was about 10 minutes. It was brief. Was it too brief? Let me know. Would you like more information or a little bit less? Would you like to take part in the next recording? Would you like to make a video to be featured on the website? I'm open to ideas and suggestions and edits. Be gentle with me. This was a trial run, but I'm looking forward to learning and implementing new things with you guys. Please stay safe, stay healthy, and remember to stay inside and socially distance yourselves.